I'm Maguire, Nurse Practitioner. I work at Mount Sinai. I work in primary care. I also have a specialty in HIV. So a lot of the patients I see are HIV positive, but I kind of do a little bit of everything. I'm going to talk about stroke and kind of talking about what type of strokes there are, what puts you at higher risk, how to prevent it. Why this is important is that in the US, a stroke occurs about every 40 seconds. Heart disease is one of the leading causes of death in women. And just looking at who's at higher risk because of many different reasons, a lot of health disparities, African American women are more likely to die of a stroke than any other women. Also, looking at another population is Hispanic women. Almost 50% of them have heart disease. And any form of heart disease puts you at high risk of having a stroke. And heart disease can be anything from high blood pressure to plaque in your arteries to high cholesterol. So it really covers a lot, and all of those things will put you at high risk of stroke, as we'll get into. So just talking about what is a stroke, a lot of us know pretty easily what a heart attack is, but a stroke can be a little more complicated. A stroke is essentially an injury to the brain. The main things that happen, as I'll get into, is either a lack of blood flow or a blood vessel can burst, which causes bleeding. And those two things can cause permanent damage to the brain, and then neurologic damage, which can lead to permanent weakness. It can paralyze people, it can cause permanent speech changes, and certainly it can cause death. So the types of stroke based on that, the most common is what we call ischemic. Ischemia is used a lot in the medical world. It's essentially a lack of blood flow. And we know that without blood flow, our body can't function. So if your blood is not getting enough blood flow, it doesn't get oxygen, and then parts of it die, leading to those changes and permanent damage. Typically, in this most common, the ischemic, the reason why that the blocking of the blood flow happens is either a clot or plaque. And plaque, I have a good image in just a minute, but is essentially most of the time caused by high cholesterol, leads to kind of almost like debris or permanent areas that are in the blood vessel that prevent enough blood flow. And over time, or in certain situations, there can be a clot or things adhere to that plaque, and it blocks the blood flow and causes the stroke. Ischemic strokes are about 80% of strokes, or maybe a little bit more, and the rest are what we call hemorrhagic. This is essentially a rupture of a blood vessel or bleeding. And then the others are mini strokes, or TIAs. This is kind of almost a less severe version of a stroke, to where you have either reduced blood flow, which causes a temporary neurologic effect, but generally they resolve within an hour. The problem is that often these mini strokes can be a sign that a major stroke is coming. But that's a pretty common thing. I think we've heard, I'm sure all of us have known someone with a stroke or a mini stroke in the past. On this page, this breaks down the two main types. So on the left, you can see the bursting of the blood vessel, and the red area is the bleeding in the brain. So that area with the bleeding is not able to function, and thus causing the injury. The right side is the ischemic, or is the most common. So you can see the red part, the red tube at the bottom is the blood vessel, and the black part is the blockage, either the clot or a plaque that's preventing that blood flow from getting through to the other blood vessel. And then it causes the black area of the brain, which is essentially a tissue that doesn't have oxygen and can't function. So this slide shows the plaque that I was talking about. The top part of the picture is a normal blood vessel. So those little red circles are the red blood cells, the blood flowing through. You can see it has plenty of space to flow through properly, deliver all the oxygen you need to the heart, the brain, everywhere that you need. In the middle picture, that yellow area is plaque. So that can be it's buildup in your arteries caused by high cholesterol. you can see there's the blood flow now has less space to go through in the blood vessel, and thus is not going to be able to move as freely. The bottom one is that the risk and what happens in a stroke is that whether it's particles or red blood cells can kind of clump up together and attach themselves to the plaque, and then the blood flow can't move through anymore, thus causing lack of oxygen delivery and stroke. I'm going to play this short animated clip on kind of what's happening in the brain, another demonstration on what's happening when a stroke is happening. I think it's important to understand what's happening so we can better understand, we can tell you all day that, having high cholesterol puts you at higher risk of stroke, but I'm a very visual person, so being able to see the picture of what's happening shows you why high cholesterol puts you at higher risk. So you could see there in that picture, actually a piece of that plaque and cluster buildup traveled to the brain. If it's not happening locally in the brain, it can travel to the brain and cause that lack of blood flow. Now I'm going to get into the signs of a stroke. Some people, if they've had a mini stroke, might be fine now, not have any permanent effects, but many people, especially if it's not caught soon enough, can either die or have permanent effects from the stroke, and they may never be able to walk or talk or understand things like they could before, or they have to relearn those, and the recovery is really long. So this is why we need to know the signs. If we know the signs, we can either recognize it when it's happening to us or when it's happening to our coworker or friend or family member. And then that allows us to be able to call 911 as soon as we can and get them the care sooner. The sooner we get them to the hospital, the less permanent effects and the less damage that is done. The acronym, or kind of the name that helps you remember in the moment, is FAST. So each of these stands for one of the signs and what to do. So these are kind of the basic and the most common signs of a stroke. In a minute, I'll kind of get into more signs that might also either you might have seen in someone or experienced, or you might see. So the first one, F, is facial droop. So the best way to ask this is to ask the person to smile. So if you smile, in a person with a stroke, one side will be a little bit lower instead of having the even smile. So F is facial droop. A is arm weakness. And this isn't just feeling like, oh, I worked out, I was lifting things and my arm is tired. It's weaknesses. You might physically see that they can't lift their arm, or even leg is dragging and not able to move it or lift it as they should be able to. The S is speech difficulty. So this can be either slowed speech or slurred speech. You can ask them, if you feel like someone's having that, just ask them to repeat a basic sentence. Say, can you tell me, your name, or tell me I feel fine. And then you can see if they're able to repeat that back easily, and is their speech kind of off or delayed, and that can help kind of signal that something's wrong. And then the T is, if you see any of these, time to call 911. When in doubt, there are things that can cause these symptoms, as far as if someone has a low blood sugar or they're having dizziness or a seizure. But when in doubt, if you see any of these things, call 911. It's best that they get evaluated. It's better to call and be sure and rule out the stroke than to wait until it's too late. So these are a lot of things to remember, but I think it'll be helpful to refer back. A good point to know is that women can have different signs of stroke, and that can present as confusion or just feeling like they don't or appear to not know where they are, or you might feel that way. Just general weakness, and generally that's something that's sudden, and all of these are pretty sudden onset, and not, I've been feeling tired for a few days. That's a difference there. If someone is having something like slurred speech or weakness and they're vomiting, that can be a worrisome sign as well. Change in your eyesight, things are blurry or just looking different. And then looking at the first one on the top left, a new onset of they can't talk well, they're walking different, whether they're having to like hold on to the wall to walk or they're walking kind of not in a straight path. If they aren't able to think clearly, the slurred speech we touched on, the numbness or weakness of the body, I touched on the arm as far as the arm weakness, but also if your face is feeling numb, that can also be a really concerning sign. I mentioned the coordination as far as not being able to walk straight, but also balance. If you're feeling like you just cannot stay upright or feeling off balance, certainly that can be due to a lot of different things like dizziness, low blood sugar, or low blood pressure. But again, it can also be a worrisome sign for stroke. A severe headache with no known cause. So if you have a history of migraines or headaches, that can be a little different. But if you don't have any history and you have just a really severe headache, especially worse than you've ever experienced, and there's no known, cause, then definitely that can be a concerning sign as well. So any one of these in and of itself can be concerning, but especially if you add more than one of these together, it's definitely you need to call 911 right away. So those are kind of big signs. And again, you can either experience this, if you look at stories online of people who've experienced strokes, a lot of times they're experiencing these things and they know something is wrong. So if you're having any of these things, feeling like you're a little confused or you can't walk right or a little numb or your vision's changing, ask the closest person to you, say, I think something's wrong. I need you to call 911. So this is something I touched in a minute ago about why is it important that we go through the fast, kind of recognition of facial droop, arm weakness, speech difficulty, because the earlier the better. There are treatments for stroke, in particular, the most common one, which is the ischemic or the lack of blood flow. We can give medications as far as intravenous and medications in a critical care emergency room setting that can stop a stroke and it really prevents really bad outcomes and can save someone's life and can preserve what function they do have. The problem is that medication has to be given within just a short window, 3 hours. So that's why if we know the symptoms, then we can recognize them early, call 911, get them to the hospital and get that process going. If we wait and say, oh, let me wait and see how this goes, or let me call, my primary care or go to urgent care, it might be too late by the time you wait through that. So you can really help save not only someone's life, but also keep them from, having a big disability from the stroke. So this is a lot. There's a lot of risks for stroke that we can think about or consider. Some of them we can prevent and some of them we can't. So I'll kind of break down, and some of them we might already have that we can't change, and a lot of those are chronic health conditions. So just looking, I'm going to skip around a little bit here. The ones we can prevent, I'm going to start with that. Smoking is the biggest one. I'm going to go into a bit more in a minute, but smoking tremendously increases your risk for stroke. So that is something we can prevent and stop. Nutrition, when we saw those pictures earlier, the plaque building up in the arteries, we can prevent that from happening by decreasing our intake of fatty foods and high cholesterol foods. Exercise. So if we don't exercise and prevent heart disease, then we just increase our risk of stroke. So that's something we can control. Those are big things. Those are the main three that we can prevent. A lot of the top ones are medical conditions that we might already have that put us at higher risk of stroke. So that's high blood pressure, which is really common. I also put on the top and in some of these abbreviations. You might see these in your medical chart. I wanted you to have these so you can recognize too. As you know, a lot of times in healthcare, we aren't very good at telling you what's going on with you. So having this information helps you be able to recognize if you see this in notes or in your chart or hear the doctor mention this, then that can help kind of help you kind of catch as a red flag. Wait, that puts me at higher risk of stroke. I need to talk to them about it. So again, hypertension, high blood pressure, diabetes is a huge risk of stroke. So if you do have diabetes and you can't change that, then what you can do is keep it under control. Uncontrolled diabetes tremendously will increase your risk for stroke. But if you keep it well under control, then you control the other factors as far as exercise, nutrition, and smoking, then you greatly can decrease your risk of having a stroke. There are certain heart arrhythmias, again, something we can't control, that can increase your risk of developing a clot and causing that lack of blood flow. A big one, a really common one I wanted to mention is atrial fibrillation, or AFib. If you have that, you should be on blood thinners and make sure that you take those regularly as your doctor tells you to. Medical term hyperlipidemia is just a fancy medical word for high cholesterol, and the abbreviation that the medical community uses there is next to it. If you have been told you have high cholesterol, you need to talk to your PCP, whether that's an NP like me or a physician. Do I need to be on medication? At what point do I need to be on meds? And if you are prescribed medication, be sure to take those regularly. I know there's a lot of concern about certain cholesterol medications, including those called statins, but a lot of times the benefit of that far outweighs any risk of side effects. And if you are having side effects from the cholesterol medication, just ask to see, I want to control my cholesterol. Is there something else that I'll be able to tolerate better? Another medical condition is chronic kidney disease. This is also something that's really common in what you may have experienced or seen in family members or friends, is that all these kind of go together. So a lot of times it's not just one thing that we have out of these, it's a bunch of things all together, and then it just keeps adding up to each thing adds another risk on top of it. A lot of times people who have diabetes will have chronic kidney disease, and then they'll have high cholesterol or high blood pressure. So all those things add on top, and then if we add on there, smoking to diabetes, it just each thing increases the possibility that you can have a stroke. Family history for sure of heart disease and stroke puts you at higher risk. So I'll mention later, it's really important to know your family history if you're able to. Some of us can't. And if you do, then to be able to tell your PCP about it. Say, hey, I have this family history. Can you be sure to make a note? I have family members who have had a stroke or who have heart disease. Increasing age, in particular over the age of 50, increases your risk of stroke. So as you get older, it gets even more and more important to know your health conditions, go to your primary care for your annual visits and checkups. Now, that's not to say that younger women cannot have strokes. So if you're under the age of 50, you can still have a stroke. And I'll touch on a few risk factors here in a minute for how you might be younger and have a stroke. As I touched on earlier, race, African American women in particular have a tremendously high risk for stroke and heart disease. So that's something that's out of our control, but we can help advocate for ourselves in healthcare settings to make sure we're being heard and seen for that. Also, if you've had a stroke or the TIA or mini stroke that I mentioned before, you are at high risk of having another stroke, or if you've had a mini stroke, to have a full stroke. So that's something, again, to make sure any healthcare provider you see is aware of and knows, so they can help prevent strokes in the future. I wanted to touch on a few other risks that women have that put them at higher risk. And this doesn't necessarily mean that these treatments are a bad thing. It's just something that makes us need to be a little bit more aware that if you're on these treatments, that you might be at higher risk of stroke. So hormone replacement in menopause, birth control, trans women who are on certain hormone therapy might be at higher risk as well, pregnancy, and a history of migraines. So this is important to know as well. If you know women who are on these treatments or fall in these categories, that whether you're around them and see the symptoms of stroke, then you need to call 911 right away. These are something that might mean that younger women, might also be at risk of stroke. So just because they're young and having symptoms of a stroke that we touched on doesn't mean that you should not call 911 or that it is not a stroke. These are things that we can do to prevent a stroke that are under our control. The first thing is exercise regularly. So the recommendation is at least 150 minutes of cardiovascular exercise a week. And this adds up to about 30 minutes on most days of the week. It's hard in winter, and especially with COVID to do this, but whether looking online for free exercise online, exercise classes that you can do, even cleaning around the house, going for walks outside as much as you can, jogging, dance, trying to find a city bike or going for a bike or swim when you can. Whatever is enjoyable for you, the most important thing is to move and also get the heart rate up. So going for just a casual stroll is good, but it may not be enough to really get that full benefit. So we want to make sure we're getting some good cardiovascular exercise in. This is really hard to do, as we've all experienced, but setting that habit and that pattern is the first step. Also, as I mentioned, maintaining a balanced, healthy diet. I know the SMART program has a lot of great cooking classes and nutrition exercise. So I didn't go into too in depth, but certainly this is, knowing that your diet can help reduce your risk of stroke is important. So not only is it for maintaining a healthy weight and preventing high blood pressure, but also preventing a big cause of death in women, which is stroke. Limiting alcohol is something that we don't always think about, but is important. For women, the recommendation is at most no more than 1 drink per day. I know we've heard in the past of like, oh, does red wine, is it good for the heart? But that's, not proving to be true. So keeping in mind that your alcohol intake can affect your heart health and risk for stroke is important. Managing stress, taking time for mindfulness and meditating. And then if you are having trouble managing your stress, is something also to talk to your healthcare provider about, or people in your life about, of what are ways that I can control my stress a little bit better. And then also knowing your risks, I think, is a big thing. So what I mentioned of knowing what puts you at higher risk can help you be aware. And then you can advocate for yourself on, what resources are in my community or through the SMART program that can reduce my stroke risk. And then also, talking to your healthcare provider saying, I know I have a high family history. I know I have high blood pressure. It's puts me at higher risk. How are we going to help prevent me from having a stroke? A lot of the things we mentioned are out of our control. We're already at risk, whether it's our age or race, or we already have these chronic medical conditions. And that's okay. We can control these and help prevent them from increasing our risk. So make sure you have a primary care provider. If you don't, there are resources in the community that can help see what health insurance you might qualify for. And I'm sure somewhere in SMART program, you might have that resources as well. But finding a primary care provider, even if they say, I just need to see you once a year, make sure you go in for that annual visit, because those screenings are important to know if you have developed or are developing risk factors for stroke. Stop smoking is a huge thing, very hard to do, but is doable. Monitoring your blood pressure. This is done at your doctor's office, but also can be done at your local pharmacy. A lot of pharmacies have that available, and I'm going to go into that a little bit more. If you do have any of those health conditions that put you at higher risk as far as chronic kidney disease, diabetes, high cholesterol, high blood pressure, staying on top of them, following the medications that are prescribed to you, and also, going to the recommended follow-up to be sure that they're monitored closely. Because if we keep those under really tight control, that really helps your long-term health and, again, will decrease your risk for stroke. As I mentioned before, I know the healthcare community is hard to navigate and communicate with. So it's really important to know these things so you can advocate for yourself and really speak up for yourself. And again, that, the health disparities in our healthcare system and our society kind of can work against a lot of people. So knowing these things can help you speak up for yourself. Be sure that you're being screened for diabetes. This is traditionally done with an A1C test. This can also tell you if you have pre-diabetes. And if you have pre-diabetes, you can really start to focus in on your diet and exercise, and then talk, to see what resources you can connect with, again, through the SMART program. I know they have great nutrition programs, cooking classes that you can really you can decrease the A1C with those measures. And make sure you're having your cholesterol checked. This is done through a lipid panel. Again, I think it's helpful to know what these tests are called. So you can, if you see these, I know a lot of people have the electronic chart that you can look online. And if you see these or they're elevated, then you can really ask, okay, what does this mean? Am I at risk of stroke and heart attack? Monitoring for chronic kidney disease is important. Asking, is my weight in a healthy range? Certainly obesity puts you at higher risk of stroke and heart disease. And also, if you aren't sure, just ask, do I have risks for heart attack and stroke? And what are those risks? What can I do about them? Being sure you communicate your health history and your family history if you know it, and saying, I just really want to make sure I have these, I have high cholesterol, I've had a TIA or mini stroke in the past. I really want to do everything I can to prevent myself from having a stroke. So stopping smoking, I just want to make sure you have this contact info. New York State has a free hotline, and you can also text them. They have a website that can help connect you to someone to help talk to or counsel you through quitting smoking. And then sometimes they can connect you to getting some of the prescription medications covered if it's okay by your primary care provider. And I put the names of the medications and what types so you can know and can ask about them. Generally, we combine a long-acting treatment as far as a nicotine patch or medications called Wellbutrin or Chantix, and then also give you a short-acting relief like gum or lozenges. They even have a cartridge that can help, that I've had a lot of patients really like and help them reduce their cigarette use. So monitoring your blood pressure and keeping it within goal range is really important. So monitoring your blood pressure, some insurances will cover a blood pressure monitor or kit. So you can ask your PCP for a prescription that you can check at a local medical supply store to see if your insurance will cover it. If you can't, try to ask around. A lot of friends or family might have one that you can borrow or just stop by and check it every once in a while. And also local pharmacies often will have that available. And then when you do check it, it's important to record it and write it down, whether it's, in a notes on your phone or the American Heart Association does have a log. If you just Google American Heart Association blood pressure log, it will come up. And then take that in when you go in for your medical visits, and you can show them, this is what my blood pressure is when I'm not here. Is this where it needs to be, or do I need to get it under better control? I just wanted to give you a few tips on when you do check your blood pressure outside of the doctor's office, is making sure that when you aren't talking when you do it, and you'll see if you know these things, you might notice it's not always done properly in the doctor's office. You can help also ask them to do it the correct way. Making sure that your legs are not crossed, your feet are flat on the ground, you have a support on your back, so you have it up against a wall or a chair. Making sure the blood pressure cuff is the correct size, and making sure the arm is supported. That might be different if you have a wrist monitor. So another thing is if you do end up getting a home blood pressure monitor, ask the pharmacist or bring the blood pressure monitor into your doctor's office so you can make sure they can watch you do it, make sure you're doing it correctly. A little confusing. I wouldn't expect you to memorize this, but I think it's helpful to see and know as far as, if you have high blood pressure. So you can see the green is good, red is not good. If you're in the orange or red zone, you're going to be at the highest risk of stroke, in particular the red. If you're in the red zone with the top number higher than 180 or the bottom number higher than 120, then you need to go to an urgent care or emergency room right away. The blood pressure that high is really high risk for stroke. So this is just a summary of what we can do overall to, again, advocate for ourselves and prevent stroke. So speak up for yourself in healthcare settings. This can also pertain to if you feel like you or your family member or friend is having a sign of stroke, saying, going back to that fast things of having facial droop, arm weakness, speech problems, or even the other ones like a severe headache, they aren't walking straight, they're confused. And especially if you know that you or the person you're with has these other risk factors, you can say, no, I really want you to rule out a stroke. Or when you do go into your routine healthcare visits, to say, I'm at increased risk of stroke, or is my diabetes or my cholesterol, blood pressure under control? I really want to stay on top of that. And then again, on that note, making sure that you're being checked for diabetes, cholesterol, and kidney disease, watching your blood pressure, moving. So moving daily, staying active. It's hard because we, as women in particular, we associate, we have this pressure of exercise and weight. But I think just reminding yourself, anytime I move, anytime I exercise, even though if I can't see it in a difference in my body, it's benefiting my health and my heart, and helping me be at a lower risk of heart attack and stroke. So again, just reminding yourself that and giving yourself that credit of, I'm moving, I'm exercising, I'm taking care of my body, whether I see it on the scale or whether I see it in a body change or not. Nourishing your body with good foods is important, going back to the nutrition part. And also talk to your friends and family, ask them, do you know your risk of stroke? If they're smoking, do you know you're at higher risk of stroke? If you Google American Heart Association, also if you look up Red Dress Project, they have really great videos. And even the Red Dress Project is a heart health prevention in women. They even have like a 10-minute exercise thing you can do online. They have really great information.